Improved exercise. 1. Stop and move. If your sport needs a full sprint, keep in mind that doing so puts pressure on your lower body muscles. Perform stop-and-go workouts to fight this. For instance, jog for 5 to 10 meters, then resume running for 30 meters at roughly 80% of your maximum effort. Follow this procedure 5 times. 2. Flexion of the knee. Almost 3 out of every 4 ACL injuries happen while athletes are landing or turning. A study in the Journal of the American Academy of Orthopedic Surgeons found that the risk of damage is much lower when your knees are bent than when they are straight. 3. Refresh, not like a headache. Heat stroke is difficult to treat. Keep yourself hydrated and cool to avoid it. Ensure that the temperature and humidity combined are less than 160. According to Dr. Dave Janda of the IPSM, this is the case. 4. Gather the necessary equipment. Training injuries may be brought on by improperly sized or fitted gear. The additional cash invested in quality equipment pays off handsomely. 5. Carry it out correctly. Poor technique is just as harmful as poor equipment. Ask professionals and trainers for advice. It will be very helpful for your workouts or training. 6. Move west, or whatever direction you prefer. Your warm-up should take into account any different directions you're playing or training in. Move in all directions, including sideways, forward, and back. Your body may then become ready as a result. 7. Make a video of yourself. The picture is accurate. Show your film to a person who is familiar with your training so that he may critique your exercise routine. 8. Allow the shoulders to relax. Any degree of rotator cuff damage can render a shoulder inoperable. To safeguard your rotator cuffs, you may wish to include stretching. 9. Take an early dip. Plan your swimming workouts in advance. Less of everything in the pool suggests there are fewer people there. 10. Take precautions. Using custom-fitted mouth guards can reduce the risk of injury by up to 82%, according to UNC at Chapel Hill Research. Spend the money on a custom-fitted mouth guard, and your smile and teeth will benefit from it for years to come. 11. Gently smooth your tendon. Get information about ultrasonic needle treatment. Ultrasound is used to minimally invasively guide a needle during this treatment. The needle removes scar tissue, breaks up calcifications, and smooths out the bone. The therapy lasted around 15 minutes, and 13 out of 20 patients reported improvements. 12. Go shoe shopping after work. After a long day of work, go shopping in the evening. It simulates how your feet would feel after 3 kilometers of jogging. 13. Go for a run off-road. Ankle stability is improved when the surface is unsteady. 14. Make a road trip itinerary. If you're biking or skiing, be sure to first conduct a dry run down the trail. Many accidents may be prevented when you are familiar with the path traveled. 15. Put forth a lot of effort in the gym. According to a Journal of Sports Sciences paper, anxiety causes a 3-degree decrease in peripheral vision and a response time reduction of roughly 120 milliseconds. The seasoned athlete relies on the abilities they've developed through practice and training when things become tough. Under stress, it keeps them cooler and widens their field of vision, so they can act much faster.